Professor Baker, great progress since we last spoke to you here on the show. So the question is New Zealand ready to move to level 1? And is it safe to say that the country is virus-free?
Greetings. Well, as you've announced, for the first time, New Zealand's is virus or has no active cases since the 28th of February when we had our first case. So it's really a time for some celebration in this country. Also, we have to use disease modelling to tell us if there are still chains of transmission that we don't know about. But that modelling also suggests that there is no more virus in New Zealand. So we've really come out of lockdown into a virus-free country.
And, Professor Baker, to what would you credit the key factors that really gave New Zealand an edge? Because if you take a look at the tally, overall about 1,500 cases of COVID-19 and 22 deaths. That is a pretty remarkable success rate there in terms of containing COVID-19. What gave New Zealand that edge, say, versus some of the other countries, even potentially Australia?
Well, I think acting quickly and decisively, and also politicians talking with scientists so that the response was science-based. And so the measures New Zealand used were a very intense lockdown, going straight to the highest level of containment when we only had around 100 cases and no fatalities, and that was in March. Also using that time to build up contact tracing. And of course, managing borders was critical to reduce the entry of infected people from overseas. So they were the critical measures in New Zealand.
Well, as part of that critical measure and also New Zealand's elimination strategy, the country has shut down its borders pretty early on, and they will stay on even if the country moves to alert level 1, possibly this week. How critical are these measures in preventing a resurgence in cases? And do you expect them to be completely lifted this year so that foreigners are allowed in again?
Well, I think the border controls are the one thing that stays at level 1. Otherwise, all of the physical distancing measures go. And so that will be a welcome change for most people. But yeah, the border controls, there's talk of 2 ways they could be reduced. One is increasing the number of people coming in through the normal quarantine process. So that's 14 days of supervised quarantine. And so that's one measure. The other approach is the potential for quarantine-free entry. And that could happen with other countries that have also eliminated the virus. And there's obviously a lot of discussions going on, particularly with Australia, but potentially with countries in Asia that have also succeeded very well in containing this virus. And I'm sure Singapore, Hong Kong, South Korea, Taiwan are on that list. But top of the list is potentially some Pacific islands that have fully excluded this virus, places like Samoa and Tonga that acted very swiftly, and they have had no cases at all.
Professor Baker, I just wonder from your perspective, looking at New Zealand's success and really the success and lack thereof of other countries in handling COVID-19, the one thing that has come out of this is the fact that the world has not been unified in implementing standardized, harmonious policies and regulations to combat this virus. It's just been so ad hoc from country to country. So when New Zealand looks at these green lanes with Australia, Singapore, whichever country has success in handling COVID-19, how important is it that these countries develop a cohesive sort of policy around these green lanes? I don't know, for instance, like Hong Kong that has the ability, for instance, to do the tests when you land in the Hong Kong International Airport. How important will that be in harmonizing all these regulations when we look to reopen these economies and travel again?
Yeah, I agree with you that a more cohesive science-based approach is needed. One thing that's the most important single factor is whether other countries have got a common approach to elimination and a similar way of measuring that. There's a huge global experience in disease elimination and eradication. There's a well-established framework for this, and it's often managed by the World Health Organization. So I think there's real potential for WHO to assist countries with harmonizing their definitions and working out what criteria we'd have for elimination. I mean, New Zealand's got criteria which it's now using. This might be the kind of model that other countries could also use. And I know, talking with other scientists, that many people have similar thoughts on this.
And Professor Baker, should a new case or cases emerge in New Zealand, how do you expect New Zealand government to react to this? Will we see them going back to the strict lockdowns we've seen in March?
Well, the hope is that our contact tracing system, which is hugely advanced from the start of the year, will be enough to manage small outbreaks. If the scale is larger, then we'd have to think about going back to a certain level of lockdown, potentially. The other thing is, I think we need to learn more from Asia, particularly your widespread use of face masks, which is something that is not common in New Zealand, but the evidence is very strong. And we've just seen the World Health Organization change its recommendations completely last Friday to encouraging the use of face masks by the public as a means of public health measure for containing infection. And this is something that's already very well established in Asia. So I think we need to learn from you in this regard.